Hi there. I'd like to say a few words about why I am such an enthusiastic supporter of ACMAC and of the principle of community and multibed acupuncture. It dates back to my first trip to China in 1981. A group of us went to Nanjing, led by Giovanni Machocha. We were there for 4 months, studying at the university, and in the mornings, every morning, working in hospitals throughout Nanjing. So I was at a large, really large hospital in the Chinese medicine department. The clinic had, I think, 4 or 5 beds, had 2 doctors, a nurse to take the needles out and do moxibustion, and there were 2 of us there as students. We had a lovely coal stove so it was warm. That was really unusual. Most of the other clinics didn't have a stove, even though it was 5 degrees below zero. So people would come in with 5 pairs of clothing, 2-3 centimeters of clothing that we had to sort of yank up to get to the acupuncture points. The atmosphere in the clinic was great. It was just really good fun. It's very positive, which in itself is health enhancing. The patient to be treated would initially sit at the table with the doctor and us, and he would go through the diagnostic procedure. But there would always be patients waiting, and they would actually inch their chairs closer and closer to the consultation to listen in and chip in. So the listening in, of course, there were some things that people wouldn't talk about in public, but that was quite common in China at the time. People didn't, for example, really talk about emotional issues. As for chipping in, it was very positive. A patient would be describing their very painful hemorrhoids, and somebody waiting would chip in and say something like, well, I had that, and Dr. Xiao treated me, and now I'm 90% better, and you must keep coming, and he's very good, and you'll definitely be cured. Don't worry. So it was enjoyable. So when I came back to the UK, I actually set up my own multibed clinic, which with 3 couches with an assistant, but I didn't have any colleagues there. So I just want to talk about what I think the advantages are, first of all for patients, and secondly for practitioners. As far as patients are concerned, apart from the real benefits of community treatment, some of which were looked at by Charlotte Whitestone in a paper she wrote. It's really interesting how people found just being together, being treated together, something happens when we share space. So it's not always appropriate, not every patient will like it, but those that do can really benefit from a kind of silent mutual support. But the main thing is that if practitioners can treat patients, put the needles in, leave them, move on to another patient, self-evidently, the amount of practitioner time required is less, and treatments can be cheaper. And we have to remember that most people find it difficult to afford a full-price private acupuncture treatment. I don't even know what the going rate is now. I'm not in practice and haven't been for a few years. But it's going to be very demanding, especially nowadays, for the great majority of people. So multi-bed clinics can bring the price right down. The second advantage, or the third, if you like, for the patient is frequency of treatment. So the once a week model, or maybe even once a fortnight model, has no historical precedent in China that I'm aware of. I think it comes from the fact that a lot of early acupuncturists were osteopaths, saw their patients once a week, or homeopaths, naturopaths, maybe even psychotherapists. So it's normal. When I was working in the hospital in China, patients were treated every other day. And if it was severe or acute, they were treated every day. And so very rapid and dramatic benefits unfolded in front of our eyes. So because the cost is cheaper, it makes it more possible for patients to come, let's say, twice a week, perhaps even 3 times a week. The final way that patients can benefit is because if there are more than one acupuncturist, so a multi-bed clinic might have 2 practitioners in the room at the same time. If it's really big, I don't know, perhaps even more, then they can consult. So if they're having challenging experiences as the patient, they can consult. Maybe they pass on the patient to somebody else they feel is better equipped to treat them. Okay, now for practitioners, I think the first thing, or the main thing, is that practicing acupuncture can be very lonely work and very isolating. So we go to a school and we study for 3 years, and then we're chucked out at the end on our own with, by definition, little experience, and we have to make the best of it. We don't really, there really isn't a consultation period, and there isn't really a mutual support system. So I think a lot of practitioners find that challenging. That may be one of the reasons that the dropout rate of people who've qualified and then drop out of practicing is so high in our profession. Being only around troubled people, sick people, unhealthy people can be demoralizing. Being around colleagues who hopefully are not complaining all the time about their health can be uplifting. And one other benefit, really important benefit for practitioners, is the single most important aspect, I think, in virtually every kind of medicine is clinical experience. You need to see lots and lots of patients to build up your understanding of people, of sickness, of the treatment you're able to give, of what you are able to help, of what you're not able to help. And it's quite hard for people who go off into solo practice to build up a really busy practice. Some will be natural entrepreneurs, very confident, will attract people to the clinic for that reason. They may be very skilled at social media. Some people will get thriving practices. The majority probably won't. And that limits the amount of clinical experience you have if you're only seeing 5 or 6 patients a week. If you have the opportunity to work in a busy multibed practice, you can see many more, you gain more experience, and you share the experience of your colleagues. So that is a short summary of why I think multibed practices are, for most practitioners and for most patients, really beneficial. It's possible in some multibed clinics to also have facilities for private consultations if people want to discuss and reveal intimate things. And multibed clinics also have the potential, I don't think it's much explored, but maybe it will be in future years, to serve as education centres, because we know from Chinese medicine that the best treatment is preventative, and helping people, teaching people through the Chinese nourishment of life lens, the Yangsheng lens, how to lead healthier lives, how to benefit existing health problems and prevent future problems, is really the goal, the golden heart of Chinese medicine. So I'd love to see a time when community clinics embrace that as part of what they offer the community. Thanks for listening.